The National Health Service, or NHS, is the bedrock of healthcare in the United Kingdom. It stands as a source of national pride, providing free healthcare to all, regardless of their ability to pay. However, this cherished institution is facing unprecedented financial challenges. The NHS is struggling to balance its books. The rising cost of care, an aging population, and increasing demand are putting a strain on resources. This financial pressure is impacting the quality of care. Patients are experiencing longer wait times, hospitals are overcrowded, staff are overworked, and morale is low. The NHS is at a crossroads. Without significant reform and increased funding, its long-term sustainability is in jeopardy. We need to find ways to make the NHS more efficient and financially secure. This is essential to ensure that future generations can continue to benefit from this vital national service. The NHS is not just a healthcare system, it's a symbol of social solidarity and a testament to the belief that everyone deserves access to quality healthcare. One factor contributing to the financial strain on the NHS is the cost of treating foreign patients. The UK has a proud history of welcoming people from all over the world. However, this generosity comes at a cost. The NHS is legally obligated to provide urgent and immediately necessary care to anyone who needs it, regardless of their nationality or residency status. While many foreign patients are residents who contribute to the system, a significant number are not. This creates a financial burden on the NHS. The current system for recouping costs from foreign patients is inadequate. The NHS can only charge £123 per person for non-emergency care. This is a fraction of the actual cost of treatment. In 2024 alone, London hospitals wrote off £112 million in unpaid bills from overseas patients. This is money that could have been used to improve services for all patients. The government estimates that consistent charging could yield £500 million per year. This highlights the need for a more robust system for recovering costs from foreign patients. While the cost of treating foreign patients is a significant issue, it is important to acknowledge the broader financial challenges facing the NHS. The demand for healthcare is rising. People are living longer. This means that the NHS is treating more patients with complex and long-term conditions. This puts a strain on resources. The NHS is also facing a workforce crisis. There are shortages of doctors, nurses, and other healthcare professionals. This is partly due to Brexit, which has made it more difficult to recruit staff from overseas. Inflation is another significant challenge. The cost of drugs, equipment, and other supplies is rising. This is putting further pressure on the NHS budget. These challenges are complex and interconnected. They require a multifaceted approach to find sustainable solutions. Simply focusing on one aspect, such as the cost of treating foreign patients, will not address the underlying issues. A comprehensive strategy is needed to ensure the long-term financial sustainability of the NHS. Addressing the financial strain on the NHS requires a multi-pronged approach. One area that demands immediate attention is the reimbursement system for treating foreign patients. The current £123 fee is woefully inadequate. It doesn't even scratch the surface of covering the actual cost of treatment. A significant increase in this fee is long overdue. This would ensure a fairer system where foreign patients contribute more realistically to the cost of their care. However, simply raising fees is not enough. The NHS needs a more robust and efficient system for identifying and billing foreign patients. This includes better data sharing between hospitals and immigration authorities. A more streamlined process would minimize unpaid bills and maximize cost recovery. Some argue that charging foreign patients will deter them from seeking essential care. However, a distinction can be made between emergency and non-emergency treatment. The NHS must always provide life-saving care, but for non-urgent treatment, a fair and transparent charging system is justifiable. Section 5. Working smarter, efficiency as a remedy. Beyond reimbursement, the NHS must focus on improving its overall efficiency. This means doing more with less. One area ripe for improvement is reducing waste within the system. Unnecessary bureaucracy, inefficient processes, and avoidable hospital admissions all contribute to unnecessary costs. Streamlining administrative tasks, embracing digital solutions, and empowering staff to make decisions can significantly reduce waste. Furthermore, the NHS can learn from best practices in other high-performing healthcare systems around the world. Adopting innovative approaches to patient flow, resource allocation, and service delivery can lead to significant gains in efficiency and cost-effectiveness. By working smarter, the NHS can deliver better care with the resources available. This requires a cultural shift towards continuous improvement and a willingness to embrace change. Section 6. Embracing the future technology's role in healthcare. Technology has the potential to revolutionize healthcare delivery and improve the financial sustainability of the NHS. Investing in electronic health records, telemedicine, and remote patient monitoring can improve efficiency and reduce costs. Electronic health records can streamline patient information, reduce duplication of tests, and improve coordination of care. Telemedicine can reduce the need for face-to-face appointments, saving time and money. Remote patient monitoring can help manage chronic conditions more effectively outside of hospital settings, preventing unnecessary admissions. Embracing these technologies requires investment in infrastructure, training, and cybersecurity. However, the long-term benefits far outweigh the initial costs. Technology can empower patients to take more control of their health. It can also free up healthcare professionals to focus on more complex cases. By embracing technology, the NHS can move towards a more sustainable and patient-centered model of care. Section 7. Shifting the paradigm, the power of community care. The NHS also needs to shift its focus from hospital-centric care to a more community-based model. This means investing in primary care, social care, and preventative measures. Strengthening primary care can help prevent unnecessary hospital admissions by managing chronic conditions and providing early interventions. Social care plays a vital role in supporting vulnerable individuals at home, reducing the need for expensive hospital stays. Preventative measures such as promoting healthy lifestyles, vaccinations, and early detection screenings can reduce the incidence of preventable diseases. This saves lives and reduces healthcare costs in the long run. Shifting towards community-based care requires a collaborative approach between the NHS, local authorities, and social care providers. It also requires a shift in mindset from treating illness to promoting health and well-being. Section 8. A shared responsibility, funding the NHS. The NHS is a shared national treasure. Ensuring its long-term sustainability is a collective responsibility. This requires adequate funding from the government. The current funding levels are not sufficient to meet the growing demands on the service. Increased investment is needed to address workforce shortages, invest in technology, and improve infrastructure. However, funding alone is not enough. The public also has a role to play in using the NHS responsibly. This includes choosing the right healthcare services for their needs. Utilizing pharmacies, walk-in centres, and NHS 111 for non-urgent issues can alleviate pressure on A&E departments. Adopting healthy lifestyles and taking preventative measures can also reduce the burden on the NHS. The NHS belongs to all of us. We all have a responsibility to use it wisely and ensure its sustainability for generations to come. Section 9. A call to action securing healthcare for all. The NHS is at a critical juncture. The financial challenges it faces are real and pressing. Without significant reform and increased funding, its ability to provide quality care for all is at risk. The issues discussed in this essay are complex and interconnected. There is no easy fix. However, by addressing the reimbursement system for foreign patients, improving efficiency, embracing technology, shifting towards community-based care, and increasing funding, we can secure the future of the NHS. The NHS is more than just a healthcare system. It is a symbol of fairness, compassion, and social solidarity. It is a testament to the belief that everyone, regardless of their background or circumstances, deserves access to quality healthcare. We must act now to protect this vital national institution. The time for debate is over. The time for action is now. Let us work together to ensure that the NHS continues to thrive for generations to come.